Okay, Jim. Harrison.
Good morning. My name is Harrison Pierce. I'm the chairman of Health and Human Services Commission. Thank you all for attending. And I apologize for this not being in person. Did do a little census, and a number of people are away for this, so they wouldn't be there in person. And also, as Bethany alluded to, the numbers, I mean, each segment of society that I happen to encounter has someone or something involved with COVID right now, sick with it. So even though the hospital numbers are up, they're not anywhere near what they have been in the past. It's still fairly significant in our community. I did call the director of the medical staff office at Norwalk Hospital yesterday to see what the census was, because I hadn't heard recently, and she said, I don't know. I've been so sick out with COVID, and everyone I know has it, and this and the other thing. So anyway, but the numbers, like at Norwalk, they are a week ago or so, they were 5. Now they're 9 in the hospital. And we do have some travelers. Barb is in Ireland, Peter's in France. Tom is at home, and we are. Where are you going, Tom, by the way?
We're going to Switzerland and Germany in 3 days.
Sounds good. We'll be thinking of
Safe till.
And the rest of us are here to varying degrees. The first item on the agenda is the approval of the June 2nd minutes. Any questions or corrections?
I make a motion to approve Commissioner Barksdale.
Second,
I
First.
second Alicia Meyer.
okay, all those in favor?
All right.
Thank you. One comment, I think it's noteworthy that Jen and New Canaan's Public Health Department being singled out as the leader in this new, what is it, Jen? What's the case activity or case-tivity? And
Yeah. What about it?
well, just that you have been singled out and you're the only people, at least the leader of this protocol and testing and whatever, right?
Yeah, we've been doing it for months.
All right, but it was just acknowledged at the last meeting in the minutes by the state, so that's why I brought it up. I thought it was noteworthy. Anyway, we will move on to reports. Jen, Health Department Director.
Jen Eielson, Director of Health, New Canaan Health Department, obviously. So you'll notice that the data of the vaccines changed because now they're using 2020 population data. So some of the categories like age 45 to 64 actually went down with the change. So that's why there's a difference from last month. We still have, lagging in the boosters of the 5 to 11, but I think a lot of that is it's July now, and they're going to wait till the fall to boost the children before the holiday season. Because if you do it now, you're going to miss the bus in the fall. So and on that, now Moderna is available for 6 to 11 as a booster dose, and 12 to 17 with the adult dose, which before it was only Pfizer. So now parents will have another option, which helps as well. Total population fully vaccinated with still 2 doses by definition, 88.44%. Total population with booster 3 doses is 56.01%. Total number of doses administered by the health department, 24,502. We're still doing clinics with Waveney and Silver Hill. We're still doing homebound. We actually did 42 of the homebound in June. And again, homebound is not just, physically, but it's anyone that won't do well in that environment. If parents want us to go to their house, we do. So we've been doing that. We started administering the Moderna vaccine, which is a 2-dose vaccine to babies age 6 months to 5. we've actually surprisingly had quite a few parents contacting us about that. We don't do those at the clinic. We do them here in our office in half-hour appointments. So the kids can stay, they color, the 15 minutes that they have to wait, and the parents are able to talk to the nurse. So it's not like a rushed typical clinic environment. We just got Pfizer this week. Pfizer pediatric for the 6 months to 5 is a 3-dose vaccine. So, so far everybody's been choosing the Moderna, so we'll see. Testing was down in June as it was statewide. But as you see, the positivity rate also decreased, which is good news because, May we got kind of clobbered with that last surge. Positivity for PCR tests is for June was 15.61 in comparison to 22.29 in May. We're continuing the testing. We're moving to Irwin Park on Monday. While they paint Vine Cottage for a couple weeks to do the lead abatement. So, it'll be nice because that's where we do the testing anyway. So, and we don't pay for Progressive. So it's us just doing the work. So even if it goes down to lower numbers, we're not gonna shut it down because there's really no point to shut it down when we're gonna be there. We might take a 2-week hiatus in August just because everybody goes away and vacations, but we'll be ready for the school year when it reopens. Cases are about even. We have 19 cases this week. We had 20 last week. In comparison, last July at this time, we only had 1 case. So even though numbers are way down from what they were in May, they're still much higher than the last 2 summers. So we'll see where that goes. There of the populations for the fully vaccinated, there's about 8.79% that are fully vaccinated that have tested positive for COVID statewide. It did a breakdown of the ages for the numbers for you guys. So you can see it's really across all age groups, especially this week. We even have in the 60s, 70s, and 80s. So it's really different. For the school cases, you can also see that, last year compared to this year of how different it was. Normally in June, we have no cases the last 2 years. And this year hasn't been that way. And we're still trending the same way. Hospitalizations have been remaining steady around 235 to 250. Stanford Hospital is in single digits right now, so hospital capacity is not an issue right now, which is good news. For all our environmental stuff, we just finished all the salon inspections and relicensing. Chris did all of those. 2 salons have closed. We did all the trucks, the septic and garbage trucks. We did 37 of those. 4 of them are still pending because Wind River didn't show up. So we're setting up a separate appointment for that. And the septic inspections are still very busy with the soil testing and the plans because of the building permits that are still remaining up. There's still a lot of activity. There's a lot of pending demo permits. So even with inflation, it's really not slowing down for us yet. So it's good news on the revenue side, not so good news on our workload side. The ticks, we had none come back with positive for Lyme bacteria, which is good news. We're in April, we had quite a few. So it's interesting to see that change. I have 1 new lead case, so which is a non-environmental case. Now the difference, so I can explain it. If you have a child under 6 in residence and you test your house for lead, by statute, you must do that lead abatement if it comes out positive, even if you don't have a child with an elevated blood lead level. So what happened in this case, it was a tenant and tested because he had 2 young children and came back positive, and those defective surfaces now must be abated by the landlord, even though there was no poisoned child. because that's the way the statute reads. So that's always fun conversation to have. The FEP grant, we just started on July 1. This year with the money, I'm gonna hire a subcontractor, Nick from Darien, who's been working with us and my staff for the last year anyway. He's our regional coordinator. So he's gonna start taking off some of this stuff off my plate because I've been the one having to do all this stuff. So that will be nice to have some help, especially with all the reports and all the updating of the plans and stuff. Pursuant to the alleged Public Act 21-46, the State Health Department hosted a series of QPR training of trainers in June, full day sessions. So now the health departments are certified. I went for 3 years as a gatekeeper trainer. The Public Act requires health departments to provide QPR training. So they don't specify how many. And so looking to do it in late fall. First of all, they have to set up the portal for us. Then we have to order all the books and all that, jazz. So this is another unfunded mandate. They don't give us any money for any of this. I have to find the money in my budget now to pay for these books to do the QPR training. They paid for the training, which is a $600 training, but not, going forward, which is typical of legislative bills. The CHIP plan, we met last Friday with Norwalk Hospital, our normal community health group that meets monthly. And the deadline for the surveys was last Thursday night. So they're compiling all the data. And once I get the data, obviously I'll share it with you guys, but we began to make the timeline to make the actual CHIP plan because it's got to be done by next year. So we broke up into groups and each group has their own part of the plan. Epi surveillance data, I posted below about the suicide data, which is another reason why the state health department is pushing this so much with local health, is because there's a statewide problem. You could see the data below the different age groups again. And then I also posted the overdoses from ODMAP because those are up as well. And where we had 0 before, now you see there's 4. So all these issues are, coming to the forefront now for a variety of reasons, COVID obviously being part of the problem. And that's it.
I have a question, Jen. Jim,
Yeah.
Ledger, Commissioner, on the young vaccinations that are just starting, because that's a 3-pronged approach, you said, you getting any reports of reaction to the shot by the young kids like the adults have?
They've only gotten their first shot for now because it just started 2 weeks ago. So it's 4 to 8 weeks for their second dose. So we'll find out shortly when they start getting the second doses. But the first dose they had no reaction to. So usually it's the second
'Cause
dose with
I
the
remember-
adults where you get sick.
I'd also like to commend Jen, this is Commissioner Barksdale again, on keeping our seniors safe. I know the vaccination rates for our seniors has been extraordinarily high, and even with the case that I just shared with Jen the other day, getting a COVID case from a hospital being discharged to us, it has not spread due to the fact that so many people have been vaccinated in that age group. So thanks to her efforts, her department efforts, I just want to commend the department for that population and protecting them, which were extraordinarily vulnerable in the first phases of COVID, certainly.
Right.
Oh, and I forgot to add, Connecticut had their first monkeypox. I put in there just so you guys can get some background information about monkeypox. The difference between monkeypox and COVID, number one, is monkeypox is not as transmissible as COVID, and it's not as deadly. It's very rare to die of monkeypox, and it won't be overwhelming the healthcare system. So that's the biggest difference. You don't have to worry about lockdowns or any of that. jazz, so to speak.
Jen, this is Alicia Meyer, Commissioner. I have a question for parents who are hoping to optimize antibody protection from the vaccine in the fall. And then I guess into the holidays, you'd mentioned that you think a lot of people are holding off till August. Do you recommend holding off till August? Also, do we anticipate that there will be new formulations of the vaccine by August that have protection for more recent variants?
By October, sometime in October, we're supposed to get Omicron specific variant boosters.
Okay.
So like, when people ask me, should I get vaccinated now in July with your 4th dose and you're over 50 years old? Well, if the other one's going to be available in October and you just, recently had the other one, especially if you just recently had COVID, I would hold off to get the Omicron specific one because you want to make sure you're optimally protected. In the summer, you're mostly outside. You're not as congested. But again, it depends on your own risk, and what your underlying conditions are.
Yeah, it's a little bit of the roll of the dice. So they will have the Omicron vaccine shortly, maybe August.
No, they said October.
No, well, those with the variants, the specific variants. That'll be October, they hope. So,
Question, are the pediatricians in the area recommending the vaccine for the children under 5? What's the,
Yeah,
Yeah.
New Canaan Pediatrics did one clinic. They don't have the bandwidth to keep doing it. We've been in communication with them frequently. So they are going to refer people to us and vice versa if need be. So they did do a clinic. They are going to do the 2nd dose. They just can't do it every day. And again, opening the vials, to do one person when we can do multiple, seems to work better that way. But yes, they
have a
are to
question.
their clients.
they are recommending it to their patients and
Yep.
care? Okay.
it's recommended by the American Academy of Pediatrics. I know of no pediatric groups that are not recommending it. Some are not doing it themselves, but so yeah, it'll be universally recommended.
Okay, thanks.
Jen, I have a question. Are there any cases of children with monkeypox? And if there are, is there anything that's going to be happening over the summer with New Canaan Public Schools? I mean, like you said, it's totally different than COVID, but I was just curious to know how children are affected by it if they are.
No, actually, right now, most of the demographic is in the 30 to 55 age range. And it's mostly the men who have sex with men category. We don't want to, say it's only happening in that, but that's where predominantly it's being spread right now with the skin to skin contact, you can transmit it face to face with droplets, but right now that's not what's happening in the US. Of course, things can change when these mutate, but right now, so far, no.
Also, Jen, so for monkeypox, people who are in that demographic that are potentially most at risk, or anyone who wants to get it's my understanding there are 2 vaccines available for that. Do they get that at their doctor, or do they need to go to the health department? There's not.
They can't get it at all in Connecticut. Connecticut doesn't have the vaccine yet.
Okay.
And because we don't have many cases and there's very limited supply in the US. So like the original one is the actual smallpox vaccine, which a lot of our older population already got. So that's the good news, is that our older population's, protected.
Mhm.
But the other vaccine, the newer vaccine, they have very limited doses. So they're only giving it to people that were directly, identified as contacts.
Okay.
So right now it hasn't even been administered in Connecticut, but the state health department's been working with STD clinics, the populations most at risk, especially in the cities that do these kind of clinics of who can be and what to look for, because it can, show up where they can be thinking that it's, syphilis or, herpes or something like that. So they also don't want it misdiagnosed, because the only lab that's testing for it in Connecticut is our state lab. And you have to get approved before they will do the PCR swab of that open pustule. So it's exact same way we started with COVID, where you need to have, you know, permission from the state. State's got to approve it. It's got to be tested at the state. I mean, I think once you get more widespread testing, you'll probably find more cases. But a lot of these, because, you know, it's nationwide, you're not ending up in the hospital because, you know, it's uncomfortable and it's, you know, unsightly. They might go kind of underground, unfortunately, because of the stigma also around, you know, how most people are getting it. But
Thank
let's
you.
hope it doesn't become a thing. I've had enough.
You need a break, Jen.
I still have one pandemic I'm still dealing with.
Understood. Thank you, Jen. Next on the agenda, Human Services Department, Bethany.
Okay, going to move along with all the reports. Food pantry, we've had an uptick in clients, and as well as the tax credits for children have been, I think they, like a month or two ago, they stopped. So we're seeing the response to that. We will feel that it has to do with the uptick in clients. We also, next Tuesday, we are giving out the farmers market vouchers to the food, to the clients, and they will have until November to utilize the vouchers and purchase items, fresh produce and anything they want at the market. Blood pressure clinics as usual. Get About is moving to another space at the train station, and they're excited about that. Back to school program starts, and the New Canaan moms have agreed to help fund that. So we will do next month, we will do the backpacks, the $25 gift certificate to Walmart, and then a back to school box that's age appropriate for the grade that they're going in. I've given you the fiscal year comparisons from 2021 and 21-22, which I started, you know, a couple of years ago, and you can look over that if you have any questions. And let me see, fire department. We worked with the Anthem Blue Cross Blue Shield employee insurance, and the fire department is interested in receiving Hep B vaccines. So that the fire chief, LB, is going to see if there is a need for that, but he did reach out asking if we could do that. And I said, yes, as long as we're doing the flu vaccine, we are a provider for immunizations at the very basic level. All right, Behavioral Health Alliance, the New Canaan Behavioral Health Alliance. We launched the meeting at Silver Hill. Actually, Silver Hill did this with the New Canaan Community Foundation, Lauren Patterson, the director, being the facilitator. Great attendance. We invited about 33 profit and nonprofit professional organizations, and we had over 35, 40 people come. So it was very, very positive. Our next meeting is August 23rd at Silver Hill Hospital again. And its purpose is, you know, we're working on is to strengthen and support the partnership to provide easier access for New Canaan residents to receive behavioral health services and assessments in a timely manner. And then after that assessment is done at Silver Hill, then a gentle handoff is done. So it's not just, you know, here, find someone to call, but we do a gentle handoff, Silver Hill does. And depending on where that person is, the journey will start for them. And if they come to Human Services, you know, we're all set. But this Behavioral Health Alliance with the professionals, this will be very helpful in terms of the next phase of someone's mental health journey. The website for Silver Hill Hospital is being launched today. I just got an email from Susanna Lewis, who's she's the community relations director at Silver Hill Hospital. So she's manning this. They have received quite a few phone calls in regards to the program. Human Services has received quite a few phone calls, and we're learning about these questions. Many people might not qualify. Quite a few people are calling wanting a second opinion. And will New Canaan pay for that? This is really a program that Silver Hill will do the assessment, the initial assessment, to see if they are right to receive an assessment. This is not a second opinion. This is someone entering the mental health navigation system, and they don't know where to start, where to go. This is the type of person, and Silver Hill is going to tweak that and figure out what's needed. But I've had quite a few phone calls saying, my child has a therapist and they have a psychiatrist, but we're not sure that he's really happy there, and maybe there's something else that he can do. So, and on and on. Silver Hill said, no, this is not how we're doing it. We are not taking on second opinions and trying new things. This is for someone that really doesn't know how to navigate the system, and we're getting them on a path. But to be tweaked, and we're taking Silver Hill's guidance on that, and in terms of who will be coming into the program and how the town will be able to help. The other thing, Active Minds. This is what I brought up last meeting in terms of a charter-based program that comes into the school system, primarily high school, although it's starting to go to middle school level. And there are many programs on Active Minds, but this program, which has no cost, is a peer-to-peer program for children, learning how to understand maybe what their friend is saying. 67% of children that are in school that have tried to complete or have completed suicide, 67% have given some indication to their friends, but the friends are not aware or know what to do. And so this Active Minds, it's based out of Washington, DC. You can go online to see it. They have agreed, and the school has agreed. We're just waiting for an acceptance from the children at the high school who work with the Kids in Crisis counselor. They have a mental health group, and they are going to be applying for this charter. And the Teen Talk counselor, I'm sorry, it's New Canaan Cares, not Kids in Crisis. New Canaan Cares. Oh, no, wait, I'm sorry, I'm getting mixed up in this is the Kids in Crisis Teen Talk counselor. He will be the adult supervisor for this, but he wants to get the okay by the kids. That'll happen over the summer. And then they'll start the peer-powered mental health curriculum in the high school and work with the Active Minds. New Canaan Cares also does lectures and has speakers come, and Active Minds has unbelievable speakers. So we're going to work with them as well on the speakers events. Susan Bliss also mentioned that the school itself is interested in other programs that Active Minds offers as well. So I think it's a good go-to, and we will stay in touch with the update. SWACA, I attended the Southwestern Connecticut Agency on Aging. I'm on their allocations committee for assessing grant requests, and the money available that we've passed is within the line of requests. And so it was very, very productive year, and many of the Fairfield County area has received the money. They're going to receive the money that they've requested in regards to senior education and health and issues associated with the aging process. YMCA, assisting in the strategic planning for seniors and behavioral health. Next meeting we're including Silver Hill with this. So that's ongoing. The vigil in September is underway. Human Services is a sponsor for the vigil, and we're engaging in the media promotion of it. The theme this year is taking care of yourself, self-care. Sustainable Connecticut recertification team has contacted Human Services, and we're working with the sustainability team in regards to the food pantry and ways they're learning about the food pantry in ways that we can become helping with food resource and decreasing food waste in the community. So we're working with them. Office of Emergency Management with Russ Kimes taking over the helm full-time. We're working on equity preparedness for during a role in emergency and just in terms of the vulnerable population. So I'll be working with him on that, and as well as we continue to help residents obtain the appropriate social services and resources as identified in the following reports from Marcy, the senior adult caseworker. She's continuing to do the outreach at LAPM. She does Life Reimagined 2 times a week, coffee with a cup once a month. And she's at larger activities and has a presence at LAPM, just, saying hello to people, seeing them, and talking to those people that maybe Aggie and the program director, Kathy, might need a little check on to, just check and see possibly any type of decline or maybe resources needed. So we'll meet with Aggie in the fall in terms of fall programming and try to see where the other programs are needed, and we'll want to add a couple more programs. Marcy's working with multiple conservators regarding vulnerable residents and care plans, seeing if there are family members that want to step up or if it needs to be awarded to the state. She continues to attend the Nuance rounds on Wednesdays out of Norwalk Hospital. And the referrals from police and fire and EMS, as you can tell from the fiscal year comparisons, they are definitely an uptick there. And she continues the home visits with Adult Protective Services. A lot of intake is going on at the protective service level, and so Marcy accompanies them. She's working with Gina Blum from Staying Put, as well as Hearst Media, regarding senior programs, issues and lifestyles, and doing little excerpts on that, articles. And then her renter's rebate continues. That's for those who are 65 and older or disabled. And so we'll usually get around 60 some people every year for that. Jackie's reports, Unite for Ukraine referrals are coming in, and she's helping gather resources for 2 families in particular. We had another family come in this week looking for help. Child First referrals keep coming in, and the needs are various for individual family issues. She has increased and strengthened the relationship with the Community Action Agency for Western Connecticut to help with back rent assistance with current clients and bringing on new families. She's working with Catholic Charities closely to see about the Ukrainian families and other families applying for state benefits. They've been very, very helpful. It's an unbelievable charity. Working with social workers from the public school system to secure spots. People are calling for discounted preschool spots and other support areas for families in need that were identified during COVID between the school and Jackie. And this month's DV, domestic violence reports, have not been received from New Canaan Police Department. She hasn't received any this month. She said that doesn't mean they haven't happened, but she just has not received them. And the divorce support group is on hiatus for the summer, and they are going to assess in the fall how to reconfigure if needed. It seemed like it was definitely a well-needed group, and they had very little input, and they're going to try possibly maybe a nighttime. This was during the day for moms whose kids were in school and they could get away. We're going to see if maybe there's a nighttime if it would work better, but just trying to see where the disparity is. If it's time, we'll switch and make a new time. If it's just lack of interest, or they don't want to be in New Canaan, there are divorce support groups outside of New Canaan, which might be frequented on a more comfortable basis if that's the issue. So the back to school lists are being generated to offer assistance to families in need. And the thanks to Alicia for spreading the word on youth and family newsletters. About a dozen moms contacted me to be added to the newsletter. So thank you, Alicia. And as of July 1st, 2022, her clients total now are 98 adults and 163 children, which add up a household. And they're working with another family and should have them added by the end of this week. So that is what's happening at Human Services. And I'll talk more about the marketing later when we get to that part of the agenda. Any questions?
Yeah, thank you, Bethany. Russ Barksdale, Commissioner. I just had a couple questions and a great data, so thank you.
Yeah.
Again for that. In here, we have under the year-round programs, a vulnerable population list, and I was just wondering if you could help me define what that means.
Okay, so that is anybody that wants to be on it, and then those that we feel should be on it, and we ask for their permission to be on it. They sign a release form. But if they are in our management, if they are a client automatically, we do put them on for the seniors. There was a huge increase during COVID because of the age, just put you at a vulnerable population. And we were each month calling like the 1,600 households. By the end of when things were calming down and vaccinations were readily available, thanks to the health department, things like that, we began noticing many people were irritated by our phone calls. So we did an outreach and said, would you like us to continue contacting us? We're here. And the majority, in fact, out of all of them, maybe a handful said, you know what, I like it when you call. The others said, we'll call you if we need anything. We're aware of your services. It's been great, the volunteer grocery shopping, but we're going to get on with our lives. So that's why the vulnerable population list now is more of a check-in, and you have to agree to be on it. We have a sign up on the website that you can contact us. It's always up in terms of availability. If you do go to the website, and when adult children call about their parents, we tell them about it. It has been this vulnerable population list, it comes and it goes.
So
And
these are basically, and I don't want to summarize for you, but these are basically clientele that you're interactive with the Human Services.
it is, yeah. And we check in, even when there's not an emergency, we say, hi, just want you to know you're on the vulnerable population list. Everything going okay? Some adult children, some have passed away. Others have moved.
But I guess if we're identifying vulnerable population, are we saying elderly that are isolated? Are we saying a child that had
that has oxygen or feeding tube, or in the event of an emergency, there's no electricity and they need medical equipment that takes electricity. It could be anything. And if anybody calls wanting to be on the vulnerable population list, a medical issue or a living situation in terms of isolation or home alone without any transportation, it can be anything.
So would a domestic violence case be on a vulnerable population list, ours?
If they asked, that would, during an emergency, no. I mean, that we want that to be a 911. We don't want to be responsible. They're waiting for us to call. No, this is
Okay. So this is
Yeah.
truly someone that says, we need Human Services interacting with us on a routine basis, and I want to be on that list.
check in, yeah. And we've had
Okay.
some set up that the fire and police, they know where a key is. So because if they can't get in, they will break in, as gently as possible. But yeah, this is an ongoing, working, live, real-time vulnerable population list. And LAPM, we work with LAPM and staying put in terms of people back and forth. And some go off of it, when we call in check-ins saying, hey, it's hurricane season, just want to know if you're still on. Oh, you know what? I'm living with my children now. I don't need this. So we keep it current because we don't want to waste time calling everybody during the event. We want to make sure this is a real working list. And we're very open to the reason they want to be on it.
Thank you.
Yeah.
Yeah, thank you, Bethany. Just FYI, Greg Sloan, whom we met at a meeting previously, HHS meeting, he's the person who's going to be the lead person for Active Minds at the high school. He's the Kids in Crisis high school counselor. And the other thing Bethany alluded to, first time only with Silver Hill, it does create issues that are going to have to be teased out further down the line. Some people have had psychiatric care, but they have been away from it for a year or two. There is an acute crisis. How do you deal with that? And others, and also in the community, there's knowledge that this is funded by governmental money. And why should this be available to only this grouping as opposed to the other grouping? So I think they're going to have to work with that.
I have a
Olga.
quick question for Bethany before we move on. New Canaan Moms is doing a fundraiser currently for, apparently there's been significant uptick in members who are experiencing domestic violence in their homes and have short-term financial needs. It's basically the situation of, and these are a population who maybe is not involving the police, definitely is not involved with any kind of social services prior to this. Essentially, kind of affluent New Canaan women who find themselves in the position of being the victims of domestic violence. Their husbands clear out the bank accounts, cut off the credit cards, and these women now have children and homes and literally $0. And so they're in a very short-term financial crisis there's really no help for these kind of people. So New Canaan Moms is doing a fundraiser because there are so many women who have reached out asking for help. Other than pointing them to DVCC, how can we help this population? I mean, I've been getting personal requests from people because they know that I'm on the commission and that I'm a former attorney, that it's sort of this hidden population of domestic violence victims who don't feel they have anywhere to turn.
Okay, so DVCC, that's where they start with us. We would, contact DVCC with them. With the stigma, what's difficult is when they come in, they want help, but they don't want anyone to know.
Mm-hmm.
And in order to get help, I mean, DVCC, and we're so confidential, but it's taking that leap of faith and being able to ask for help. That is the professional group that knows how to do it. So we like to stick with them.
Mm-hmm.
If they don't want to go through DVCC, there are more regional domestic violence centers, but DVCC could guide them through that.
Mm-hmm.
In terms of the knowledge base, that's where they need to start after they see us, or if they just want to go to DVCC, we won't know about it.
Mm-hmm.
Ferguson here, Commissioner. Would it be, this seems to be a pretty hot issue now, and at least these comments are a little troubling. Should we have somebody from DVCC at our next meeting to give a little background on what they do and how they handle various kinds of situations?
I mean, we do give them money, and we meet. I'm on the meetings with Jackie, who runs it, with another co-chair, and happy to see. Let's maybe Jackie. I mean, if she runs it or DVCC, we can get.
They could even zoom in.
Yeah, that's what they do. Yeah, so we have a Zoom meeting once a month, And yeah, it's incredible what they do. And I think, you know, the education in terms of what they do, yeah, go to their website, see what they have. But that really, I mean, that's the top of the line in terms of getting the best help, the quickest. And they know all the resources in terms of financial and things like that. And I really, really rely on them.
Bethany,
I think
Commissioner
that's-
Barksdale, when you say you give them money, you mean the town?
So the Human Services, they request 10,000 every year for the past few years and we give them 5. Maybe this year when they ask, we, you know, to consider upping the grant request, but that money goes towards helping the clients that come into New Canaan, Human Services. And Alicia, I know it's the confidentiality. Nobody wants anybody to know. And that's why if you want to take it out of New Canaan, DVCC is not just New Canaan, and it brings it out into the, you know, into the county wide, and maybe they'll feel less.
Yeah, I think part of the problem too, I've been hearing anecdotally from people, is that a lot of the resources DVCC has available, financially, the women don't qualify for, because in theory, they're part of a household that makes too much to qualify for these services, but their husbands are in control of the finances and have literally
Yeah,
taken everything
and
away.
they've dealt with that before. I mean, yeah, and also it is, it's hard to change a way of life.
Yeah,
It's hard.
I
to
had a comment. I was wondering, you guys have the gas cards and the grocery cards. Do women need to qualify or give
No, we give
permission?
those. We do give
Can they
those.
come in there? And because I know one of the things that
Yep.
was mentioned in the New Canaan Moms post is that they needed things like gas cards or grocery cards. Is that something that they can come in and get without
Yeah.
signing on to
Yeah,
their
but-
confidentiality privileges?
Yeah, and we would just give them the cards. They would not have to do a financial assessment for something like that.
Would that be okay with you if we put that on New Canaan Moms, either Alicia or myself or whatever, that people could come in? Or maybe we could contact Allison.
Well, yeah, if they want to contact Jackie or Marcy, you know, contacting a caseworker. We just, you know, yeah.
That's great. That's a
that-
great idea.
So that they come in
I-
and, you know, when no one else, you know, we just make it more confidential as possible.
I
And
think that
are
would be
likely for
great.
them to come in if no one really, you know, if they know who they're going to be talking to, and it just makes it more user friendly for a conversation on the phone first, if they're more
Commissioner
comfortable.
Barksdale, again,
Yeah.
to add on to Tom's piece, I think if we as commission were more understanding of kind of the services that were out there that were being provided, as you indicated, you know, they're asking for 10 and we're giving them 5. I'm wondering if some of our other resources should be put towards more education and training, and maybe we can use New Canaan Moms as a platform or other platforms. And, you know, I feel, and I hear all the time, domestic violence issues that are not brought out, don't go through the police department. The wife or the battered spouse feels uncomfortable reaching out to anyone. But if there is educational and support groups and things of that nature where we can help in that access, if it's nothing more than education, I think we should take the opportunity to do that if we can.
So there, you know, I agree. And there have been just the divorce support group, which very often, a lot of the domestic violence issues, there is a divorce in progress. And those that were interested, you know, no. And that's why we did it during the day, knowing the people that we thought, and they didn't want to show up. So there's a
And
whole
yeah.
psychosocial aspect to it. But yeah, Russ, I mean, let me get DVCC, see if they can come in, you know, just
Thank you. Thank you.
I was just wondering if in the future with budget, you know, coming up, if we could have an angel fund for people that kind of fall in that area that don't want to be necessarily formally enrolled in a DVC group, if they could get money.
Well, that's the thing though. We want people to get help, and it's a slippery slope. I don't think the town really should be dealing with handing out money in terms of domestic violence. They need to see someone, that's a slippery slope for their safety and for everything. And a whole
see.
plan needs to be put into action.
Alethea, can you give us an idea of numbers? Is this 1, 2, 5, 10?
Oh,
From New Canaan Moms,
yeah.
they did an anonymous fundraiser because they said several people had reached out. And then for me personally, I've gotten 3 personal
Wow.
contacts from people saying, can you help? And so I was able to help find lawyers just through my lawyer network that I have. I was able to get some referrals who could be flexible with giving the retainer until their financial situation is, because it really is a short-term situation. But when they're in a situation where they literally don't have a dollar to go to the grocery store, and they're trying to find a lawyer to help them, and the lawyer says, you need to give me $25,000 retainer or I can't talk to you. And so I was able to give some referrals, and I haven't heard whether, how it was all, I don't even know the people. I was contacted through third parties. So I don't even know the exact people involved. But the
Yeah.
fact that New Canaan Moms is doing this fundraiser because so many people have reached out to Monica and Allison who run it, I think speaks to this.
Yeah, and there was a discussion about, could money go through from the New Canaan Moms to the, straight to Human Services, but that's a slippery slope. We really can't, and then pass out the money. That's really not the scope of Human Services. And I felt badly, but did the GoFundMe page, but a lot of it has to do with these families, these people experiencing domestic violence. They need to talk to a professional. They need to get a plan, and they just can't wing it. I know it's a panicky time, and we've got to get a plan, a professional help. That will help them, not just the money. So I really don't want to be they can come in and we can, I can do the gift cards and get them for that crisis moment, but it's not sustainable. They need help.
This is clearly a significant issue. And I
Yeah,
agree with Tom. I think if we could have a 10, 15-minute session with the DDDC person,
yeah,
our next meeting, just to inform us.
excellent.
And then we can
Absolutely.
go from there.
Yeah, great education. Yeah.
All right, well, we have to move on to new business. These are some of the action items that came forth from the last meeting. The role of the commission. We as commissioners have the roles of oversight and an advisory position. And we all have either interest or education and experience, and often a combination of things to facilitate this. Sometimes I wonder, looking at how good HHS is functioning, both on the health and the human services side, if we are, maybe we want to be doing more than actually needs to be done. Although when you bring up this little domestic violence and what's going on with some of these families, it opens your eyes somewhat. And a lot of the things that we do is there's so many others contributing in our society to the same thing. We mentioned United Way earlier on, New Canaan Cares, all the religious groups, the primary care physicians, the hospital groups, you name it, the LAPM, and there is some overlap in what all we do. But anyway, this I'll just open this up for discussion, the role of the commission and what we are doing. Then we can address the next 3 issues after that. So any comments, discussion points?
Well, one thing, Jim Lisher, one of the historic roles has been to look for needs in the community within the health and human service areas. We sort of take care of that automatically. And again, one of the things you just said and that we've just been talking about is the amazing power of the community itself and the role of human services and the health department in coordinating all these many different groups in town. From the standpoint that we have led over the years, several studies of seniors and youth and whatnot. and needs for the future. I'm not sure there's any need for that right now. The one thing that we've all been talking about are areas of mental health, and we'll come back to that in a minute when we talk about Newtown. But from a standpoint that the only thing that's missing from the oversight and advising is the research or the search and sensitivity, I suppose I'd call it, to needs in the community in our areas of interest. But short of that, I mean, the amazing thing, and when we talk to Newtown and I talk to other towns, it's astounding to me the power of the community in this area. We are so lucky, and we have, with the catalyst being the health and the human service departments leading the process and keeping the communications open, how we're able to do that. So I don't see any need for research right now. At one point, Selectman had asked that I take a look at senior housing once again, but I sort of avoided that. I don't think that's a need right now, but that's just my opinion.
Yeah, I think they're sensitive to some of the issues going on in town. If you saw what Bethany sent around in terms of, what are the most pressing needs of the community, and we look at ours and we look at the state. If you look at the state, it's housing and shelters by far and away number one, then mental health and addictions, followed by healthcare and COVID-19. Those are the three categories. If you look at New Canaan, it's healthcare and COVID-19 was by far and away number one, 87+%. And housing and sheltering are down at 2.7%. So it's really the state and our community are very different things. But it's just something we continue to ask ourselves about the role of HHS and what are the pressing needs of the community, and are they being met? I think right now, as much as nothing's perfect, but they are being met. And again, back to the health component with COVID, and Jen has done a great job with Chris and Shannon and Deborah and whatever. It's like a full service phenomenon. It's a model for the state. And Health and Human Services too, with all that they've done in this time of the pandemic, et cetera, which has been admirable. So any other?
I'm wondering how we could play a bigger role in the town's budget process. It seems to me that we have a health department and human services department that are doing wonderful jobs, have very full plates, and we need to make sure that they're adequately funded and staffed, which I know has been an issue in the past. When we're thinking, they're all, like Jen keeps bringing up, there are all of these unfunded mandates coming down, and are we able to use town money to help her, execute those mandates? And just overall, how can we advocate to the Board of Finance, the Board of Selectmen, setting priorities in the health and human services space?
I'll let
We're-
Bethany answer that, but it gets political with the dollars, and people, look at the mill rate, et cetera, et cetera. And, if it's not impacting them directly, and the town does allot money to HHS, to increase that. And this is not my area of expertise, so I'll pass it on to maybe Penny wants to comment on that. Yeah.
Penny.
I was just gonna say the reporting, to the various bodies is pretty thorough, at least as you now know with town council. Kim and I and any number of other council members are sitting in your meetings. But when you prepare your budget, you put into the thinking of what your requests are, what the percentage need is, and the impact of those dollars. So I think you already are having impact and input into, the budget that goes forth. If you all feel there are greater needs than a flat budget, really will address, then it's up to you all to present budgets that reflect that with the, data to be supporting what the increase in budget numbers, would be covering and why. I mean, so it's a process that exists now. As I said, if you think there are greater needs than what you are addressing, then it's up to you to substantiate, why your requests are greater. Because you've had flat budgets for a number of years,
Yeah, it's good. Thank you.
Christina,
I just have a question. Are there any grant applications that are done by your department to the
Oh.
state?
Sure.
And
The health department has several grants. that
and we
it's-
have,
it's-
we have.
It's a lot of work for me, but that's what helps fund my nurses and the part-time public health emergency preparedness coordinator.
And
to
we have.
offset.
would help in that group, a person dedicated to writing grants, be of help to the department as a whole, to your entire group?
Well, I think that on the town side, they really need a grant writer because more than just the health department, you can be getting grants for your sidewalks, for everything else.
Right.
I mean, most towns have at least a part-time grant writer and we don't. So I have to write my own grants. I have to do my own reporting, financial and everything. And it becomes like for the $11,000 grant, it becomes such a pain in the neck. You almost feel like keep the damn money because it's so much work. But
Exactly.
That's the thing.
Exactly, but I think it's an important issue to raise, especially during budget process, because unless it is spoken out and everybody hears it, nobody sees the need.
yeah, because I think they're missing the boat in a lot of departments where you can be getting substantial money.
Yes.
You look at these neighboring communities who have grant writers and they're funding entire, $1 million projects to do things.
Correct.
So,
Correct.
yeah.
Public Works gets a ton of money. I think Tiger is constantly,
Not always, not always. There are grants that have been missed and they don't have grant writers to write everything.
Fine,
I
okay,
think
well
it-
then let's propose having a grant writer.
Yes.
You know,
We have,
Thank you.
we have the grants that we have for human services. They're, Jackie writes them, I write them, we do our deliverables. They're a great help for the Get About. And then Jackie does this children equity grants. And, but like Jen said, the deliverables and the time spent and what you get in return, you really have to weigh that. And sometimes the work doesn't fit the amount.
I think these-
Commissioner Barksdale, again, I think what I'm hearing, if we're trying to put it all together, if we can give the Board of Selectmen, I'm sitting here reading through our charter and our direction, but if we can give the Board of Selectmen, the Town Council, here are the 3 things that we believe we need money for, additional money. Angel investors, I'm sure that will come out and support these things. But if we identify those 3 things, which we've been talking about for some time, domestic violence, we still don't have a report here on what's happening in our school from our school nurses. I know that Chief of Police had asked for a police officer in one of our schools. So I think similarly, we need to come up with those 3 or 4 things, quantify them, say we need grant, because I agree with Penny, there is a lot of grant money out there and available to us if we had someone that spent the time to submit those grants instead of it falling on Jen and it falling on Bethany's staff to get that done. So I'm trying to take everyone's opinion here and put it into an actionable step. And that would be to identify those 3 things. I think DVCC will help us in figuring out what those dollar amounts need to be from that standpoint. And me as one commissioner would vote that domestic violence is an issue. But I'd also like to see a report from what's happening in the schools, from the school nurses, and if there's anything there that we need to focus our attention on.
I think as far as securing a grant writer, I think what would have to be done in the form of a proposal is to have the various departments perhaps put through a report of the effort that is involved in preparing a grant. And if it would be facilitated by having, a grant writer, because you use, there's a lot of data that is just common to all the departments because it has to do with the government reporting and documentation, and those things just slip right into a form. So it doesn't make any difference what department you're, requesting a grant from. So bottom line would be, if the amount of grants that would be highly likely to, be achieved, does that pay for a grant writer? Because you're gonna, run into the head count.
Well, you could do like Wilton does. Wilton has the grant writer take a percentage of the grants, so it comes right off the top. So the grant
Yeah.
writer gets an incentive to get more grants because they get more money off the percentage.
Well, let me propose that to the first selectman and see where we go with that.
Yeah, that's-
It should be self-financing. I mean, if it costs, however much it costs on the payroll, and if it isn't, you don't do it, but obviously.
I
it
would
should-
talk to Wilton.
Well, I think if they go around and do a little survey of our surrounding towns or our like communities as to what their programs are for grant writing, you may come up with some common threads of what are effective from a job description standpoint and the likelihood of
Right. Great.
Thank you. I think what we'll do,
Harrison, this is
Yes.
Tom here. I just, the question you raised, I had a couple of thoughts. One, it would be nice to know what other towns do. And I don't know much about what other towns do. And I realize towns may organize activities under different names, so forth. But are there things that other towns do that we just don't do at all, or vice versa? So I'm a little uninformed on that. I wish I were better informed. And the second thing is, have we asked the commissioners, and maybe we haven't, I have a bad memory, but for their input on what our priorities are and should be? And have we had a group discussion on that, focused on that? Our meetings tend to be going through a pretty set agenda each time. And not a lot of time set aside for sort of prepared discussion and back and forth. And I just wonder if we should, at an upcoming meeting, dedicate an hour or whatever to a discussion, make sure we're all on the same wavelength about the priorities.
what
And
we-
the other thing is that when we say that we should be doing something that maybe we're not doing, I would never want the staff to feel like they're not doing the job, because they do an outstanding job. But our job is to, on the commission, is to have eyes and ears on the community. And, Alicia's comments today about the Buchanan moms is a very good example of that. Feeding that back to the staff and making sure that we as representatives of the community and citizens here are giving the best input and setting at least some direction for the staff and the town. So those are my thoughts.
Thank you, Tom. I think we do have a time issue here. So we will address these latter two issues at the September meeting. The next item on new business is structure of the meetings. Bethany, do you want to quickly address that?
I did do research in terms of having human services staff attend these meetings. And in terms, I was trying to think, once again, what we just spoke about, cutting down on time and being productive from your end versus report giving from our end. So the reason that Marcy and Jackie are not here, there were a few reasons. I discussed it with the first selectman, and he agreed, that there are no other caseworkers or staff from any other department that attend these meetings and give reports. So thus, he said he was fine with it. I checked with the 10 directors in the surrounding towns that I work with, and not one of them has a staff member come unless there's a new program or something that needs to be explained that the director doesn't know. Otherwise, the reports are given by the director. And there's not one department in New Canaan that has their staff come on a monthly basis. The caseworkers also feel it's inappropriate to discuss and answer case-specific questions, even though names are not given. They feel with the public and the media access to these meetings, it leaves room for potentially a breach of confidentiality should any viewer or listener live near that person or know someone and know what's happening. And that, so it's a little iffy in terms of bringing up some of the situations when asked. So with that all in mind, moving forward, the caseworkers will, give me their reports on a monthly basis and I can run through them.
Thank you, Bethany. Next, and if you have questions regarding that, you can please bring them up at the next meeting. Next item, disseminating information as the commissioner or as a commissioner. Alicia brought that up at the last meeting. I think as far as the commission, if we are unanimously want to go public with any information, comments, et cetera, we can do that. I think individually as a commissioner would not list themselves as a commissioner of Health and Human Services. Any disagreement with that?
So you broke up, Harrison, on my end. Will you say that again? I don't know if anyone.
If we as a commission want to go public, newspaper, whatever it may be, New Canaanite, with information, comments, et cetera, then yes, we can say Health and Human Services Commission. But as an individual member of the commission who wants to state something, they have First Amendment rights, but I don't think they should align themselves with the commission when it may not be the sense of the commission.
Right. Actually, when Jen Hadlick and I went to Newtown, we were very specific that we were there to exchange information and that we did not represent the town of New Canaan nor the commission. But
Good job, Jim.
Say again?
Good.
Good, thank you. Last item on the new business is marketing. So Bethany has connected with the New Canaanite, with Mike Dinan, and want to tell us what's going on, Bethany, and I suggested doing the same with the advertiser, but whatever.
Right, so I've contacted them as well. So I was thinking maybe New Canaanite, when I look at it, they're little boxes with the advertisements about area resources and businesses. And I contacted Mike and said, what can we do at Human Services? Is that possible? And so he gives a 40% discount for those little boxes, depending where they're placed. Top boxes are $500 a month, middle boxes are $350, lower boxes are $200 a month. We would get 40% off, so it would be $300, $210, or $120 a month. And he said he could try, devise or design a little box maybe. I would like to do that with the town logo and say New Canaan Human Services, helping residents obtain appropriate social services and resources, please call us. And then with the phone number. If somebody wants to design something else, I was thinking maybe Alyssa, but she's not here today. She does well with graphic designing. I contacted New Canaan Advertiser for the same thing. They do not offer any discount. And we would be considered retail.
Yeah,
It's a whole different ballgame, small town New Canaanite paper versus Hearst Communication. And so I know that Alyssa had some communication with somebody at the advertiser from the New Canaan level. And I was hoping maybe she could get us more information. I am emailing them, but it takes a couple days for someone to get back. And it's a very,
okay, let's do Church Street.
it's just not great communication, and I'd like to get to a deeper level of someone working with, and I think maybe Alyssa can help me on that. I'm waiting for a price list without a discount. It's not on their website, but this is really a classified high-end media group that we'd be dealing with. But as Harrison said, the senior residents read the New Canaan Advertiser. And so I think we do need to put something in that paper as well. But we've got $10,000 on the public health, is it public health meeting programs, $10,000. I think maybe this might be a good place to put some of the money. So if the commission wants to decide, how many months they want to run, maybe start it in September, not in the summertime, maybe when people are back. But I thought maybe this could be. I also keep, in touch with the library, LAPM, YMCA, and all the faith-based organizations, constantly, sending them things. But if we get this little design set up in a box for the New Canaanite, I'd like to see if we can put it on, the other newsletters in town, such as LAPM, Library, the Y. And we're working closely with them. I don't see why there's a reason that we can't get that put out in the newsletter. For these,
Bottom line is, as good as Health and Human Services are or is, we want to make sure everyone is aware of the services that HHS provides. And so this is one way of doing that and guaranteeing. So we thought maybe when people come back from summer vacation, September, October, November, we could do that. We could finance that, and we see how remunerative it is in terms of people coming anyway, and also doing something in the advertiser to deal direct more with the senior citizenry. So that was the motivation for that. I think is a good idea, and we'll go forward with it to some whatever extent is possible. Again, thank you all for attending. Jen, thank you so much for doing the minutes with this. It's all recorded, so you have a backdrop if you need it. And hope everyone has a very enjoyable summer. We will meet in September, and we'll TBD as to where.
Yeah.
And again, thank you.
Motion
All
to
right.
adjourn.
Thank you, everybody. And the recording is going to stop.
Thank
Thank
you.
you.
Happy summer.